HESI A2 Anatomy and Physiology Skeletal System. Introduction to the skeletal system. Welcome back to our HESI A2 Anatomy and Physiology series. In this video, we'll explore the skeletal system, the remarkable framework that supports, protects, and enables movement in your body. By the end of this video, you will be able to identify the functions of the skeletal system, describe bone structure and types of bones, understand bone formation and growth processes, differentiate between axial and appendicular skeletons, recognize common skeletal system disorders. Overview of the skeletal system. The adult human skeleton consists of 206 bones that work together as an integrated system. Primary functions of the skeletal system. Support provides structural framework for the entire body. Protection shields vital organs from injury. Skull protects brain, ribs protect heart and lungs. Movement works with muscles to enable locomotion. Mineral storage stores essential minerals like calcium and phosphorus. Blood cell production. Red bone marrow produces blood cells through hematopoiesis. Fat storage. Yellow bone marrow serves as an energy reserve. This system is dynamic and constantly remodeling throughout life. Bone structure. Every bone in your body has a sophisticated structure designed for strength and function. 3 main layers. Periosteum. Outer fibrous covering. Contains blood vessels and nerves. Essential for bone growth and repair. Compact bone. Hard, dense outer layer. Provides strength and rigidity. Contains osteons, functional units. Spongy bone, cancellous bone. Inner layer with a honeycomb structure. Contains red bone marrow. Reduces bone weight while maintaining strength. This layered structure maximizes strength while minimizing weight. Classification of bones. Bones are classified into 5 categories based on their shape and function. Long bones. Found in arms and legs. Examples: femur, thigh bone, humerus, upper arm. Enable leverage for movement. Short bones. Cube-shaped, provide stability. Examples: bones in wrists, carpals, and ankles, tarsals. Flat bones. Thin and protect organs. Examples: skull bones, ribs, sternum. Irregular bones. Unique shapes for specialized functions. Examples: vertebrae, pelvis bones. Sesamoid bones. Embedded within tendons. Example: patella, kneecap. Bone cells and bone remodeling. Bone tissue is living and constantly changing through the activity of specialized cells. Types of bone cells. Osteoblasts build new bone tissue by depositing calcium and minerals. Osteocytes mature bone cells that maintain bone tissue. Osteoclasts break down old bone tissue to make room for new growth. Bone remodeling process. Continuous cycle of bone formation and resorption. Regulated by hormones like parathyroid hormone, PTH, and calcitonin. Allows bones to repair microscopic damage. Helps maintain proper calcium levels in blood. This process continues throughout life, completely replacing your skeleton every 7 to 10 years. Bone growth and development. Bone formation occurs through 2 main processes during development and growth. Ossification, bone formation. Intramembranous ossification. Forms flat bones like those in the skull. Bone develops directly from connective tissue. Endochondral ossification. Forms most bones in the body. Bone develops from cartilage models. Growth in length. Occurs at epiphyseal plates, growth plates. Cartilage cells divide and are replaced by bone. Growth plates close after puberty, ending height increase. Explains why children's bones heal faster than adults. Axial versus appendicular skeleton. The skeleton is divided into two major parts based on location and function. Axial skeleton, 80 bones. Forms the central axis of the body. Includes skull, vertebral column, and rib cage. Primary function, protection of vital organs. Appendicular skeleton, 126 bones. Includes arms, legs, pelvis, and shoulder girdle. Primary function, movement and locomotion. Attaches to the axial skeleton. Understanding this division helps organize the complex skeletal system into manageable parts. Skull and facial bones. The skull protects the brain and provides structure for the face. Cranium, 8 bones. Forms the protective case around the brain. Includes frontal, parietal, temporal, and occipital bones. Bones are joined by immovable joints called sutures. Facial bones, 14 bones. Include maxilla, upper jaw, mandible, lower jaw, and nasal bones. Provide structure for facial features. Form cavities for eyes, nose, and mouth. The skull's design balances maximum protection with minimal weight. Vertebral column, spine. The spine provides central support and protects the spinal cord. 5 regions of the vertebral column. Cervical vertebrae, 7 bones. Neck region, most mobile. First vertebra, atlas, supports the skull. Second vertebra, axis, allows head rotation. Thoracic vertebrae, 12 bones. Chest region, attached to ribs. Less mobile due to rib connections. Lumbar vertebrae, 5 bones. Lower back region, largest vertebrae. Bear most body weight. Sacrum, 5 fused vertebrae. Forms back of pelvis. Provides stable base for spine. Coccyx, for fused vertebrae. Tailbone, vestigial structure. Attachment point for some muscles. Rib cage and sternum. The rib cage protects vital organs in the chest cavity. 12 pairs of ribs. True ribs, pairs 1 to 7. Attach directly to sternum via cartilage. Provide strongest protection. False ribs, pairs 8 to 10. Attach indirectly to sternum. Connect to cartilage of rib above. Floating ribs, pairs 11 to 12. No anterior attachment to sternum. Protect kidneys and provide flexibility. Sternum, breastbone. Manubrium upper portion. Body middle section. Xiphoid process lower tip. This structure allows for breathing while protecting heart and lungs. Appendicular skeleton upper limb. The upper limbs are designed for manipulation and tool use. Pectoral girdle. Clavicle, collarbone, connects arm to trunk. Scapula, shoulder blade, provides muscle attachment. Arm bones. Humerus upper arm bone, longest bone in upper limb. Radius lateral forearm bone, rotates during pronation/supination. Ulna medial forearm bone, forms elbow joint. Hand bones. Carpals 8 wrist bones allowing flexible movement. Metacarpals 5 palm bones. Phalanges 14 finger bones, 3 per finger, 2 in thumb. Appendicular skeleton lower limb. The lower limbs are built for weight bearing and locomotion. Pelvic girdle. Ilium largest hip bone, forms hip crest. Ischium sit bones, bear weight when seated. Pubis front portion, meets at pubic symphysis. Leg bones. Femur thigh bone, longest and strongest bone in body. Tibia shin bone, larger weight-bearing bone of lower leg. Fibula smaller lateral bone, provides muscle attachment. Foot bones. Tarsals 7 ankle bones including heel bone, calcaneus. Metatarsals 5 bones forming arch of foot. Phalanges 14 toe bones. Types of joints. Joints are where bones meet and determine the type of movement possible. 3 main categories. Fibrous joints. Joint capsule surrounds the joint. Synovial membrane produces lubricating fluid. Articular cartilage covers bone ends. Synovial joint movements. Synovial joints allow various types of movement essential for daily activities. Primary movements. Flexion, decreasing joint angle, bending elbow. Extension, increasing joint angle, straightening elbow. Abduction, moving away from body midline, raising arms sideways. Adduction, moving toward body midline, lowering raised arm. Rotational movements. Rotation, turning around axis, shaking head no. Circumduction, circular movement combining flexion, extension, abduction, adduction. Forearm movements. Supination, palm facing up, carrying soup. Pronation, palm facing down, pouring out. Common skeletal disorders. Understanding common bone and joint problems helps recognize when medical attention is needed. Osteoporosis. Bones become weak and brittle due to calcium loss. More common in older adults, especially postmenopausal women. Can lead to fractures from minor trauma. Arthritis. Joint inflammation causing pain and stiffness. Osteoarthritis, wear and tear of cartilage. Rheumatoid arthritis, autoimmune condition. Fractures. Simple, closed, fractured, clean break, skin intact. Compound, open, fracture, bone breaks through skin. Green stick fracture, partial break, common in children due to flexible bones. Early detection and treatment improve outcomes for all these conditions. Key takeaways. Let's review the essential concepts from this module. The skeletal system provides support, protection, movement capability, mineral storage, and blood cell production. Bones grow and remodel throughout life through the balanced activity of osteoblasts, osteocytes, and osteoclasts. The skeleton divides into axial, 80 bones, skull, spine, ribs, and appendicular, 126 bones, limbs, and their attachments. Joints enable movement, with fibrous joints being immovable, cartilaginous slightly movable, and synovial freely movable. Common disorders include osteoporosis, weak bones, arthritis, joint inflammation, and various types of fractures. Bone health depends on adequate calcium, vitamin D, and weight-bearing exercise. Thank you for watching HESI A2 Anatomy and Physiology series. You now understand the skeletal system structure and function as the framework that supports all other body systems. Remember that the skeletal system you've learned about today provides the foundation for the muscular system we'll study next. Each system builds upon the others, so keep connecting these concepts as you prepare for your HESI A2 exam. See you in the next video.